Hi, I'm Dr. Pam Chally. I'm the Interim Provost and Vice President for Academic Affairs at the University of North Florida.
And I'm Diane, the Chief Nursing Officer for Baptist Health. We want to welcome you today to our virtual reception for Volunteers in Medicine, and we invite you to join us on a tour.
Volunteers in Medicine is such a wonderful gift to the city of Jacksonville. It's the only clinic that provides free health care to the working, uninsured, low-income individuals in our city.
And nothing is more important than good health. It's the basis upon which we build our relationships, take care of our families, serve in our community, work in our jobs. And when you don't have access to health care, you're doubly handicapped, both by economics and by your health.
There are more than 100,000 working uninsured in Duval County. These are individuals that we come in contact with every day.
These are people who are working hard every day, but they cannot afford health insurance.
Which is why Volunteers in Medicine is so important. They are making such a difference in our city. Complications from diabetes and hypertension are decreasing. Cancer is being treated and lives are being saved. There are free medications and free eyeglasses. The impact that this clinic has on our city is phenomenal. So join us as we take you on a tour of the Volunteers in Medicine Clinic.
And see for yourself the difference that this organization is making in our community.
The clinic is well equipped to serve the low-income, working uninsured, and their families, with 6 exam rooms and 16 medical specialties all under one roof. Patients are offered free vision screenings and eyeglasses, nutrition education, as well as mental health counseling if needed. The on-site dispensary provides much-needed medicine that many patients wouldn't be able to afford otherwise. These services function as a safety net, keeping many of our citizens healthy, working, and providing for themselves. With only 8 employees, Volunteers in Medicine relies heavily on the dedication of more than 220 volunteer medical professionals and laypersons each month who give selflessly of their time. Together, they ensure that patients have the care they need so that they can remain healthy and employed.
One of my favorite stories from Volunteers in Medicine is a gentleman that was referred to me by a local emergency room. He had been seen in the emergency room 10 times in the last 6 months for exacerbation of his asthma. He was about to lose his job due to his absences. Once we were able to get him into Volunteers in Medicine, we provided his maintenance medication as well as his medication for acute flares of his asthma. In the last 1 to 2 years since we've been treating him, he's not gone to the emergency room or missed work due to his asthma.
One of my patients that was striking had some very significant concerns when we talked to her about anxiety and depression, and she admitted once we further questioned her that she did have suicidal thoughts and even had a plan, so that's very concerning to us. We were able to actually take her right down the hall to our mental health therapist that was there for that day. We put her on some medication. She started therapy weekly here and has turned around and is doing beautifully.
See people here that my heart goes out to them. They have no places to go, and even if they go to places that they don't have the resources, they're not treated with compassion, with dignity and respect. When they come here, I make them feel home, and I treat them like my member of my own family. So it's very rewarding to see these people who have never haven't smiled for 2 years, and they come over here, they get cured, and they put a smile on their face.
Volunteers in Medicine is a very important asset to the Northeast Florida community. We are a medical home for the working uninsured, an often overlooked population. These are our friends, our neighbors, our relatives who are all in jobs but unfortunately don't have access to affordable health insurance.
I'm just living paycheck to paycheck. And if I were to have to add health insurance on top of that, I would go under. I would not make it. It just wouldn't happen. And I work 40 hours a week. You know, I do the best I can. It's just the way it is. Without them, I think I would be in serious trouble because I wouldn't have had the medicine. So I probably would have had a stroke or possibly even a heart attack by now because my blood pressure would not have been controlled and my diabetes would not have been controlled. And that I would probably be I would probably be in a nursing home having had a stroke or something and not able to take care of myself at all. I'm thankful that they're here and they're helping me to live a good life, an abundant life, a healthy life, and I appreciate that. And the people in the community are healthier, the community is healthier. And so you're keeping people out of hospitals, out of nursing homes. You know, you're making people able to work. You know, it's a good thing. There's no downside here. It's a good thing.
Thank you for coming to visit us and learn about Volunteers in Medicine. It's surprising that the only source of income for these very important medical services are from donations and grants.
This clinic receives no federal funding, but because of their model of care, for every dollar donated, they can give $5 worth of health care. So even a small gift goes a long way to improving the health of our community.
Yes, your gift to Volunteers in Medicine will provide health care to the working uninsured who are trying so hard just to stay ahead. So on behalf of our staff, volunteers, but most importantly, our patients,
we want to thank you for coming to our virtual reception, and we hope you've enjoyed it. But most importantly, we want to thank you for your generous support of Volunteers in Medicine.